Hello, my name is Monica Gamarca and I am a nurse practitioner student from William Patterson University, and today I'm going to perform an assessment of Heent, head, ears, eyes, nose, and throat of an 18 years old who belongs to a pediatric assessment. Lindsay, I'm gonna ask you a few questions. Your parents are here. Do you want your parents to step out or to stay here?
They can step out.
Okay, so the parents are stepping out. So I'm gonna ask a few questions to her. Lindsay, do you take any medications?
No.
No. Okay. Do you take any vitamins, any supplements?
No.
Okay. Do you have any stress, depression? Do you suffer any stress, depression?
No.
Any concerns?
No.
Anything that you want to share with me? Okay. Do you ever feel like do you want to kill yourself?
No.
No. Do you feel that you are a threat in your house? Are you safe in your house and everything?
Everything's good.
Okay. I just want to ask you if you are sexual active right now.
No.
Okay, so we can see that there's no issues psychological, that she's not depressed, she's not anxious, she doesn't see like she is reporting any significance or any mental problems. So for now I can say that she is a healthy 18 years old, and she's parents are here, are giving consent to assess the child, and she's 18 years old, just turned 18 years old, and female. I can past medical history is patient doesn't have no medical history, doesn't have no surgeries, no allergies, and she's fully vaccinated. Family medical history, as per parents mentioned, is they don't have no medical history on the mother or father's side. I'm gonna do a ICD code 10 Z00.129, which means encounter for routine child health examination without a normal finding. So we're going to start with the vital signs. We already set up the vital signs before the video. Her blood pressure was 112/70. The heart rate was 76. The respiration was 16. Temperature was 98.2 Fahrenheit. The O2 saturation was 99 on room air. Her weight is 135. Her height is 5'4", and her BMI is 22 kg, which is normal for her age and height. So we're going to start with the head. We can see that her head is, by looking at her head, we can see that her head is normal. We can check her hair is clean. I'm going to palpate her head. I don't see no bumps noted, no tenderness noticed. I can see her texture of her hair is well distributed. Also, I don't see no lesions or flickings around her hair or her head. Her shape is normal cephalic. Also, I don't see no anomalies. Fontanelles, for her age, fontanelles are not applicable because fontanelles are noticed on kids under age 2. So we're going to start with the eyes. I can see that her eyes are symmetrical, no redness, no discharge noticed. Also, I see that her lids are intact. We're going to check for extravasement. So we're going to do a Herbert test, which means that I need you to look at me. Head up, look, and I'm gonna see her reflex. So we can see that there's no extravasance noted. Also, we're gonna check for the slump of palpebral, which we can see in her eyes that her division here is normal, so is absent. Also, we're gonna check on her extraocular movements. So with that, we're gonna check the directions. I just need you to follow the line. So we can see that there is no is intact. in all directions, so it's normal. We're gonna check also her pupils. With pupils, we're gonna use the acronym PERLA, which is gonna be meaning the pupils are equal, round, reactive to light, and accommodation. So in this case, look at me and look at the eye. Look at the thing. So we can see that the pupils are equal, round, reactive to light, and accommodate. So now we're gonna check her conjunctiva, sclera. So let me see, I can see that her sclera is white and clear. Her conjunctiva is pink almost. I don't see, I think everything is clear and smooth. So we're gonna see also her nasolacrimal. We can see that her nasolacrimal are not plugged. So I can see there are no plugging on the duct. So that means that it's a normal finding. We're gonna check now the red reflex. So with the red reflex, we're gonna check it. I need you to look at the eyes, and I'm gonna go close to you. Open. So I can see that her red reflex is present, bilateral and symmetric. So we're gonna check now the visual field. So we're gonna do the Snell testing. So I need you to cover one eye and read the smaller line.
LTFPH.
And cover the other line, other eye, I'm sorry, and read the smaller line.
LTFPH.
So that means that the patient has 20/20. Also, we're gonna test confrontation. So with that, I'm gonna cover one eye, and she's gonna cover the other eye, and she's gonna let me know how many fingers she sees. So cover one eye, and I cover the opposite eye, and I'm gonna tell me how many fingers do you see.
2. 2. 2.
Okay, switch.
2. 2. 2.
So that means that her peripheral vision is intact. So let's inspect her eyes. We're palpitating. Any pain? So we don't see no pain, no swelling. So open your eyes. We see no ptosis. Her eyes are symmetrical, so we don't see no ptosis. So now we're gonna go ahead and inspect her ears. So looking at her ears, I can see that her ears are symmetrical. I don't see no abnormalities. No tenderness. I can see her pinna is intact. Her external ear is clear. No abnormalities. I don't see no discharge on the outside of the ear. So, and everything I see is aligned normal. Now we're gonna inspect her ears. So we're gonna pull up and back, and we're gonna check her ears. I can see that her ears are clear, no serum inside. I can see that her tympanic membrane is purely gray, is intact, and it was visible. And let's check that other ear too. Also is clear. I can see her tympanic membrane. Also that is pure clear. So I don't see no abnormalities. There's no cerumen impaction or anything. So now we're gonna check the hearing. We're gonna start with the hearing. We're gonna do the whisper test. So I need you to cover one ear, and I'm gonna whisper a word, and you're gonna tell me what did you hear.
Apple.
Same thing in the other. Cover. Pear.
Pear.
So meaning that her here is a normal bilateral. Also, we're gonna go check now the nose. So now I can see, I'm gonna check her nose but in inspecting her nose, I see that her nose is symmetrical, midline. So I don't see no deviation or perforations around her nose. I can see there's no tenderness. She doesn't feel any pain. So I'm gonna check in her nose mucosa. I'm gonna put my gloves on. So I need you to put your head up, and I can see that her mucosa is pink, clear. I don't see no discharge, no bleeding inside, so that no deformity, no lesions, so that means that's normal. Like I said, no deformation, no tenderness. And now we're gonna palpitate her sinus, the frontal and the maxillaris sinus. So no tenderness, so to palpitation or percussion. So now we're gonna go ahead with the mouth and the throat. So I'm gonna inspect her mouth. Like I see her mouth is symmetrical. I don't see no abnormalities. There's no lesions, no discharge, nothing on the external area. I just need you to I'm gonna check her mouth. Can you open your mouth? I can see that her mouth and her teeth are clean. There's no discharges. Her tonsils +1. Say ah. I can see that her uvula is midline. I don't see no abnormalities in there. Her teeth and gum are clean, well aligned. I didn't see any caries. Her gums are pink. Also, I don't see that there's any abnormalities or tenderness around her mouth. Now we're gonna check the cranial nerves number 9, 10, and 12, which is the gut reflex. And I'm just gonna need you to open your mouth, take out your tongue, move your tongue side to side, say ah. Gut. Oh, and she has the gut reflex, so that means that her cranial number 9, 10, and 12 is intact. Her tongue is midline and her uvula is right midline too. I need you to swallow. She can swallow perfectly with no discomfort. So now we're gonna check her neck. By checking her neck, I can see that her neck is symmetrical. I don't see no abnormalities, palpitation, no tenderness. So can you turn your head to the side, to the other side, back, front? I'm gonna try to push your neck to resistance. Look, the other side and the other side. So I can see that it's full ring of motions with no stiffness. So now we're gonna check her trachea. I can see that her trachea is midline. So that's a normal finding. I'm gonna check now. I'm gonna palpate her pulses, the carotid pulses. So I'm gonna do one at a time. So I can feel that it is a pulse 2+, which is a normal finding. And I'm gonna check the other side. Same thing, 2+, and amplitude as a normal finding. I didn't feel no bruits on it. So also I'm gonna auscultate, and I'm gonna use my belt. So I didn't hear any bruits bilateral, so that's a normal finding. So now we're gonna palpate the lymph nodes. So we're gonna start with the back lymph nodes, where is the pre-auricular. We're gonna go on the tonsils, submandibular, submental, superficial cervical, supraclavicular, and the occipital. So no tenderness, no enlargements, no nodules, so that is normal finding for her age. So now we're gonna well, inspect her thyroid. Like palpitation, I didn't feel no nodules, no tenderness, so no enlargement. So that's appropriate for her age. Um, Also, let me just check. I need you to forward a little bit, head up, so we can check her thyroid. Swallow, so she can swallow without problem. So this is the end of the assessment. I can say that the examination was complete with normal limits for an 18 years old. No abnormalities detected. The vision, hearing was intact. No sinus tenderness. Um, no tire enlargement noted. At this time, I will not recommend any referrals needed. I will suggest that she come back for a follow-up, a routine annual follow-up. Um, if she feels any discomfort or she's sick, she can come back for a sick checkup. But for now, there's no referral needed at this time. Thank you.